Hi, today we're going to be talking about the 12 cranial nerves. My go-to phrases for the remembering the 12 cranial nerves in order is O to travel abroad, find very good views and hotels. Cranial nerve number 1 is the olfactory nerve. The function is the sense of smell and it is sensory and it originates in the telencephalon of the cerebral cortex and terminates in the olfactory bulb. Cranial nerve number 2 is the optic nerve, which is the function of vision. It is also sensory and it originates in the diencephalon near the third ventricle. It converges with the contralateral optic nerve to form the optic chiasm. Cranial nerve number 3 is the ocular motor nerve. The motor is also meaning the motor function and the eye movement of the opening and closing of the pupil size. It originates in the mesencephalon and ends in the superior orbital fissure to the orbit of the eye. Cranial nerve number 4 is the trochlear nerve. The function of this nerve is eye movement downwards and laterally. It is motor and it originates in the mesencephalon and enters the orbit after going through the superior orbital fissure. Cranial nerve number 5 is the trigeminal nerve. The function of this nerve is the sensation to the face and mouth, as well as chewing, and it is both sensory and motor. It originates in the pons, which is in the brainstem, and the trigeminal nerve then splits off into 3 other nerves, the ophthalmic, maxillary, and mandibular nerves. Cranial nerve number 6 is the abducens nerve. The function is eye movement from left to right, and it is also motor. It originates in the pons and exits through the superior orbital fissure and into orbit. Cranial nerve number 7 is the facial nerve. The function of the facial nerve is the facial expression, the taste of the anterior 2/3 of the tongue, salivation, and the production of tears. It is both motor and sensory and originates in the pons and exits through the internal auditory meatus. Cranial nerve number 8, the vestibular cochlear nerve. The function is hearing and balance. It is sensory. It originates in the pons and travels parallel to the facial nerve, which is the previous nerve we talked about, cranial nerve number 7. Cranial nerve number 9 is the glossopharyngeal. The function of this is the pharyngeal musculature, the posterior 1/3 of the tongue, tasting and swallowing. It is both sensory and motor. It originates in the medulla oblongata of the brainstem, which is the center for swallowing, and exits in the posterior cranial fossa. Cranial nerve number 10, the vagus nerve. The function of this nerve is it controls all of the visceral or the inside organs, swallowing and gag reflexes, both sensory and motor, and it originates in the medulla and passes through the jugular foramen. Cranial nerve number 11 is the accessory nerve or the spinal accessory. The function of this nerve is head movement, swallowing movements, and shoulder movements. It is a motor nerve and originates in the medulla and passes through the jugular foramen. The last cranial nerve is cranial nerve number 12, which is the hypoglossal nerve. The function of this nerve is tongue movement and the muscles of the tongue. It is motor and it originates in the medulla oblongata of the brainstem and it exits posterior cranial fossa through the hypoglossal canal. The nerves that are specific for speech language pathology are 5 and then 7 through 12, which are our main areas of the nerves that we focus on. Thank you.